Now let's talk about IV push medications. So you guys have already learned how to give meds orally, through the peg, IM, eye drops, all that kind of stuff. Now we're going to skip all that digestive process and we're going to go straight into the vascular system. So we have to be really, really, really careful what we're giving through an IV because you're skipping all the body's natural mechanisms of absorption and we're just putting it in there. So we always want to make sure we're double checking, if not triple checking our orders when we're doing IV medications. That being said, we've got a patient here who is puking and needs some Zofran, so we're going to do some ondansetron or Zofran, which is 4 milligrams per 2 mLs. So we're going to end up pulling up 2 mLs. The things that we need for this is we obviously need our med, we need our needle and our syringe to pull it up, and then we need flushes because we're going to flush before to clean the line, and then we'll flush after to finish cleaning that line with the med in it. We also need an alcohol wipe to clean it. Whether you wear gloves or not depends on your setting. If you're in a setting where, like in the ER, where a patient's coming in and there's blood and stuff everywhere, you're going to want to wear gloves to protect you. Now, some people don't wear gloves because it's considered a closed system, and I'm not going to touch anything that's wet, sticky, and not mine. So it just really depends on your setting, whether you wear gloves or not. And I'll let that be your critical thinking for your own setting. All right, so we're going to give our friends some Zofran. We're going to make sure that we ask them their name and date of birth and that this is the right order for to give them. They may not like us a whole lot when they're not feeling well, and that's okay, but safety always comes first. We're going to want to make sure that we alcohol wipe off the top of that because it's already been exposed. Okay. And then I put a little air in my syringe. I don't do the full 2 mLs because that will cause it to kind of blow up a little bit. But then go ahead and pull out your medication. I always like to prep my meds first before I get in the, before I'm getting in the room or right at the computer when I'm at the hospital. So it just kind of, again, depends on your setting and where you are. All right, so I've got my 2 mLs of medication. Okay, and then I'm going to go ahead and safety lock that because we do not stick the needle into the system. It's a luer lock or a screw system. So I'm going to keep, somehow I'm either going to keep this next to it, or sometimes if I'm going to have to walk a little bit, I will write the med on here. Okay, and I want to get all the air bubbles out because I don't want to give my patient air. So I'm going to say, hi, I'm Jane. I'm here to give you your Zofran, your name, date of birth, feeling kind of nauseous and sick. Okay, we're going to help take care of that. The other thing we have to pay attention to when we're giving IV medications is some of them burn as they go into the vein. So we have to pay attention to the how fast we're pushing medication. All right, so you've seen me. I'm cleaning the hub here. Okay, I've got my saline here. I kind of prime it and get that air bubble out. I like to usually shake it off a little bit and get it out. And you push and screw on. And then this is just saline. So sometimes I push. Well, in a peripheral, we have to do at least 5. You can do 10 unless your patient is on a fluid restriction, and then you really don't want to give them any excess fluids. Okay, but if she's throwing up, she could probably use a little extra. I don't think that's going to hurt her any. Okay, and our flush really doesn't matter how fast we push it, just a nice steady rate. Okay. And here's my Zofran. I've verified, I've scanned, I've primed it so that I don't have any air bubbles. And again, push and screw it on. And then Zofran, we're going to push over, depending on the facility or what your research says, about 30 seconds to 2 minutes. So I'm going to sit here and just kind of talk to her a little bit while I'm giving it, telling her, that the medicine's coming, it's going to get in her system. We're going to help her out. She's going to be feeling better here in just a little bit. You might want to talk about if she feels a headache. Zofran can have a side effect of a headache. So always good to kind of know your side effects so you can kind of tell them. You might if you get a headache, let us know. Maybe we'll give you some Tylenol once we get the nausea under control. Okay. The other thing you can be doing during this time is assessing your site to make sure that it's not blubbing up around there. You probably do that when you do your flush, just because it's a bigger volume, you'd see it more. And then we'll also talk about different complications that come with IVs. Other things that we have to think about when we're doing IV medications is it compatible with what's going in? So if you have a patient who's already hooked up to some fluid, we want to make sure that we're compatible. So if I had given this Zofran with, and they had like dextrose going, I need to make sure that that is a compatible mixture. All right, so we're almost done with our Zofran here. All right, and I'm going to unscrew this, and I'm really careful not to let that tip touch their skin or anything like that. If it does, I just need to re-clean it with an alcohol wipe. Okay, so here again, I'm going to get that. You can kind of see that air bubble in there. I'm going to pop that bugger out and try. All right, and then push and screw it on. Okay, and really important with our after flush is that medicine is still in that tubing, so we need to push this flush relatively at the same rate that we pushed our medication with. So if I pushed it slow, I need to push at least the first 5 mLs or so pretty slow to make sure that that medication is in their system, and then after that I can go a little bit faster once that tube is cleaned out of all the meds. All right. So I'm going to tell Jane you're going to be feeling better here soon because we've got some Zofran in, and so hopefully we're going to be taking care of some of that nausea. Let us know if it doesn't help you, and then we'll have to see if there's something else we can give you. And remember, 5 mLs is all we have to do for a peripheral IV, but again, you can do the full 10. It just really depends on what's going on with your patient. And that is how we give an IV push medication.